Hey, this is Dr. Ho here. Excited to tell you about our Orthology On The Go program. This is our virtual monitoring platform. We're leveraging the technology from dental monitoring as well as coupled with our protocols of how we're following patients' treatment in Invisalign, plus our clinical team that will review and respond to your scans and your questions. So I love the dental monitoring system. It really helps ensure our Invisalign treatment proceeds smoothly, on track, and that we can get efficient and great results. But the system it depends on your help. So as you may have heard, you're going to be doing weekly scans from home using the dental monitoring app. This is what we see on our end. So on our dashboard, we see your scans. We see a whole history of scans. We can see how if you're on time, on track for your scans, and if there's any teeth that are not following. You can see we get a really great view of your trays, and we can see how your teeth are progressing. We can check tray fit, hygiene, recession. There's quite a lot that we see from these images, but I wanted to highlight one thing. So in general, you're going to be scanning every week for your Invisalign treatment. You're going to scan. Ideally, you do it in the morning. It takes quite a while to process. We eventually see it on our end, and you get a message back saying you can go on to your next tray, or you want to stay on the same tray for a few extra days. Don't be discouraged if you get a message to stay on the same tray, because that just means your teeth have not moved enough. Your biology just needs a little bit more time to respond to the forces from the trays. And if you wear the trays for a few extra days, we can ensure that your trays follow with how I designed your treatment so that we can finish your treatment efficiently. So you'll get either a go or no go. If you get a message to change, you switch to the next tray. You scan again in a week. If we say don't switch to the next tray, it'll prompt you to scan again in a couple days, and then you can see if you can switch to the next tray or not. What I want you to watch out for, so you can see here the tray fit is great. If you can see here, there's some examples, 1 to 4. 1 is what I want to see. I would love to see the trays fitting perfectly, really hugging the teeth. 2, you can see there's some minor gaps developing. Not bad. This is what it may look like when you first switch to a tray, but after the end of wearing it 7 days or up to 14 days, it should look pretty good. 3, you can see there's a pretty big, what we call unseat or not tracking, where there's a pretty big gap. 4, there's a rather large gap. I don't want it to become 3 or 4. If I see it like a maybe a little bit more than a 2, somewhere around a 3, I will say wear the trays for a few extra days. You can try to use some chewies. You can try to push the tray in, wear the trays more so we can get it back to a 1 or a 2. If you're at a 4, we'll likely ask you to come into our office so we can scan your teeth and reorder your trays, design a whole new set of trays that will capture how your teeth are fitting. Because why there's a space is telling us that from how I designed your teeth to move and your trays, your teeth are not following that design. Your teeth need more time to follow, or we may need to rework the plan if it's way off. What you can do to help is wear the trays a lot, 22 hours a day, and keep up with your weekly scans.